Hello viewers, welcome to Let's Talk Health by Star Hospitals. Today we have with us Dr. Sainath. He is a senior medical oncologist in Star Hospitals, Nanak. Today we are going to discuss something about cancer of prostate. I am going to tell about the medical surgical aspects, and Dr. Sainath is going to enlighten about medical aspects and what are the recent advances in chemotherapy and who need it when you are going to have that. Hello, sir.
Hello, sir. So, today we'll be talking about prostate cancer. So, the first things, what is prostate cancer and how common is it in our society?
Previously, the traditional thought was it was a Western disease. Now, maybe because of our checking up at the age from start 45 age, we are seeing more and more prostate cancer patients. Previously, we used to diagnose that in very advanced stage. Now we are picking up it in early stage. That's a good sign, so that at least we can give them a option of complete cure. Regarding the incidence, when compared to the Western world, still India is having a very less prostate cancer patients.
So, like you said, even though it's a Western disease and it is catching up, so it makes us more important. What are the symptoms? Because without identifying, when the patient knows that these are the symptoms, then only he'll be able to approach you. So, what are the symptoms which everyone should know, especially men above the age of 45, 50 years?
Yes, sir. See, prostate cancer per se doesn't cause a specific symptoms for the cancer. Usually, they will be having a symptoms of outlet obstruction, same like as benign prostatic hyperplasia, something like obstructive LUTS we call it as. Obstruction is like frequency, urgency, nocturia, poor flow, recurrent infections. These are the simple common symptoms where the patient presents with. Some patients, they will be presenting with advanced disease, something like bony pains, acute urinary retention, and some sort of secondary symptoms like liver failure and shortness of breath also.
So, you have elaborated a list of symptoms which a prostate cancer patient can present with. So, what are the tests you recommend to diagnose it early? And is there any kind of a screening test which we can do to detect it even before the symptoms happen?
Every now screening patient will have a PSA. Every set of screening test have PSA in it. This PSA is prostatic specific antigen, which is a very wonderful diagnostic test for evaluation of the prostate cancer in a normal screening pattern. It not only picks what I mean to say is it sensitivity and specificity, we call it as this PSA. The sensitivity is high, but the specificity, whether it is related to the prostate cancer, some sort of infections also, it can pick up. So the specificity of the PSA is not up to the mark, but the sensitivity of picking up the prostate cancer is very high. So that is a gold standard for diagnosing as of now, gold standard for diagnosing the prostate cancer in early stage is the PSA only. Apart from that PSA, we have an array of investigations which diagnoses the prostate cancer, like simple ultrasound, and there is something called PET-CT, that is prostatic membrane specific antigen PET-CT, and apart from that, simple digital rectal examination of the prostate. When it is hard, it directly says that there is something abnormality in the prostate.
So, who do you think should be screened regularly for PSA and digital rectal examination in a patient who doesn't have any symptoms?
If the patient is having a family history of prostate cancer, you need to check the patient from the age of 45. Your screening should be at 45. Apart from that, there is something called ethnicity, race, and depending on the locality where they are residing, Is it a Western world patient or Indian patient? Depending on all such things, we need to check the patient. It's a blood-based screening test. There is nothing much is involved in it, just simple one blood test. It's the screening should be started from age 45.
Thank you, doctor. So, given that in early screening will detect the patient in early this thing, what are the surgical modalities available to cure this cancer?
See, once the diagnosis of the prostate cancer is confirmed, the next step is to evaluate what are the complications he is having, what are the tests to identify the metastasis, whether the disease is localized or it is residing in only in the prostate or it has spread to something somewhere else. To know such things, we need to have a PET CT, and if the disease is localized, then surgical aspects come into the play. And depending on the ECOG score, something like patient comorbidities, if the patient is willing and he is fit for surgical aspects, surgery is the gold standard for the prostate cancer, which is localized. That is radical prostatectomy, whether it is a robotic radical prostatectomy, open or laparoscopy. But robotic radical prostatectomy is going to be a gold standard in the management of the prostate surgery.
You talked about robotic prostatic surgery. What is the advantage it gives as compared to the other techniques of radical prostatectomy? Does robotic prostatectomy offer any additional advantage to the patient?
Yes, sir. It has a very good advantage over a conventional open or laparoscopic radical prostatectomy. See, the complications when you encounter during the post-radical prostatectomy is incontinence, erectile dysfunction, which is very minimal when compared to the conventional method to the robotic radical prostatectomy. We can preserve the nerves and we can preserve the continence with the robotic radical prostatectomy. Apart from surgical aspects, once the patient is escaped from the disease, something like advanced disease, then Dr. Sainath, the specialty comes into the picture. That is a medical oncology coming to the picture. Today, he is going to enlighten us about what are the surgical, apart from surgical aspects, what are the medical options available once the patient is escaped from the localized disease. Sir, we are very much interested to know what are the options do we have apart from surgical disease.
So, like you rightly said, that a lot of patients do present with advanced stage disease, and a few of these high-risk patients who have undergone even local therapies, they subsequently might present with advanced disease where the disease has spread to bones and lungs and liver. So we have good modalities. So the speciality of a prostate cancer which separates it from the other cancers is it is very much hormone sensitive. So it depends on testosterone for its survival. So we have good hormonal agents which decreases the levels of testosterone, what we call androgen deprivation therapy, which is a simple injection. And apart from that, we have newer hormonal agents like abiraterone, enzalutamide. So these drugs also act on these hormone receptors, the androgen receptors of the prostate cancer cells, and thereby controlling the disease and improving the quality of life. Now, beyond this, we do have chemotherapy drugs which actually work very well in prostate cancer.
When you have rightly said there is options called hormonal therapy, and you enlightened very elaborately on the hormonal therapy. Apart from hormonal therapy, what are the when hormonal therapy is going to be acted, and when we are going to add the chemotherapeutic drugs, what sort of people is suits for these chemotherapeutic drugs? What are the options do we have, sir?
So the recent advances in prostate cancer tells us that all patients with advanced disease, even when they are newly diagnosed, once they present, apart from the hormonal therapy, in addition to that, either adding a second hormonal agent or chemotherapy upfront improves the overall survival of the patients, improves the quality of life. So it improves the longevity, and the patient will be off a lot of medications for a significant amount of time. So the chemotherapy which we commonly use in prostate cancer is docetaxel, and when it is used in initial part of the disease, the tolerance is better and they have a longer disease control. Apart from that, hormonal therapy and chemotherapy, we do have newer therapies like peptide receptor radionucleotide therapy, which comes in the later part of the disease. And also there is a new array of lot of targeted therapies which we use in prostate cancer.
The beauty of the prostate cancer treatment is, for this disease, we have a very good checkpoints. Take from the surgical aspects, medical aspects like hormonal therapy, chemotherapy, and advanced targeted therapy, which Dr. Sainath has enlightened us about. Apart from this, sir, what are the, there is something called genetical counseling, genetical targeted therapy, genetical testings. What are this? Can you enlighten us about that, sir?
So what we understand is, like you have initially in your talk, you have emphasized that when there is a family history of prostate cancer, apart from that, patients whose mothers or sisters or anyone affected with breast or ovarian cancer, certain percentage of men with prostate cancer also have these genomic alterations.
Okay. Do you mean to say this, if the mother is having some breast cancer, there is the children will have a chance of having cancer prostate?
Yeah. So we have certain genes like BRCA1 and 2, BRCA1 and 2, and RAD51. These genes predisposed to familial cancers. So in females, it causes breast and ovarian cancer. In men, it causes prostate cancer. So these patients do benefit from what we call the newer targeted drugs called PARP inhibitors. So every patient of prostate cancer ideally should undergo. So the younger the patient, the stronger the positive family history, they should definitely undergo. Apart from that, what we see is in the biopsy specimen, we look for homologous recombination, HRR gene deficiencies. So these patients also have this familial predisposition for prostate cancer, and the important therapeutic implication is that all these patients do very well with PARP inhibitors, the newer targeted therapy. So definitely all these patients, now it is recommended to undergo genetic testing either on the biopsy specimen or in the blood sample.
Is it the genetical testing is blood based or biopsy based, sir?
So there is something called the germline mutations, which is checked in the blood of the patient. In the tissue, we look for the genomic alterations which might be present in the tumor as well. So if it is inheritable cancers, we find these HRR deficiencies or BRCA1 or BRCA2. And if there are other genomic alterations like microsatellite instability or high tumor mutation burden, so these are detected only on the biopsy. So if these abnormalities are there in the biopsy, even immunotherapy can be tried in these patients. So what we suggest is to do a germline testing in the blood as well as on the biopsy specimen to do a comprehensive genomic profiling so that we get an idea that what are all the targets, what are all the targeted therapy or immunotherapy we can use in that particular patient.
Very nicely elaborated, sir, about regarding the cancer prostate. Good thing to know about is don't worry, the prostate patients, every checkpoint is there. There is whatever the disease is, early stage or localized disease or advanced disease, there are many treatment options available, whether it is surgical aspects or medical aspects or hormonal therapy or chemotherapy or radiation therapy. Today we had elaborative sessions with Dr. Sainath. Thank you very much, sir. Thank you, and once again, thanks for the elaborate.